Griffith for your 5 minutes of questions.
Thank you very much. You're very kind, Madam Chair. Ms. Arthur, it's my understanding that vaccine developers have received emergency use authorization, but when they receive that, they're not free to communicate information about their vaccine because the vaccine doesn't have an FDA-approved label. Is that true?
So yes, under an EUA, companies that have that authorization cannot directly talk to healthcare providers.
And so you mentioned healthcare providers. What entities are prohibited from receiving information about vaccines that do not have the FDA approved labeling in addition to healthcare providers that you just mentioned?
So by and large, companies focus their direct energies on information to healthcare providers, that's pharmacists, nurses, doctors. So that is the primary audience they would mostly share information with, and those providers would share information with the general public.
And so
companies also do talk to insurance companies and state health departments as well.
Now, COVID's gotten a lot of attention, but how might these entities use that information about vaccines? And if we see a problem developing in the future, but maybe not shuts the whole country down, do you think it would be helpful if companies were able to share that information with healthcare providers?
I do. I think that it's extremely important because companies should have a way to, with the approval of the FDA and with the shared messaging, following the guidelines of their authorization, to be able to actually speak to healthcare providers so that healthcare providers have the latest possible data. Healthcare providers are extremely busy and they can't necessarily keep up with all the information that's happening every day. We're all trying to do that. So certainly as we go into this next phase of the pandemic, where we're going to have updates on by age, we're going to have updates on the performance of the vaccine for variants, healthcare providers probably have quite a number of questions they're getting from their patients and from mothers and fathers, and this would certainly help them more quickly answer those questions if they could have a systematic interaction with the companies on the approved information.
Well, and as a parent of children who are in that 13 to 16 age bracket, I might want to know, ask my healthcare providers, which vaccine do you think is better for my child with his background? And they're both boys, with his background. And so in answer to the question that the chairwoman asked, what are we missing? I have recently introduced a bill, HR 3705, that would allow vaccine sponsors who have received an EUA to communicate information about the vaccine to certain entities without fear of violating the law. And based on what you've said, I think you would think that something along those lines would be helpful for the both the producers of the vaccines, the developers, but also for the healthcare providers and then those of us who rely on our healthcare providers to give us the information. Am I reading that correctly?
Yes, sir, you are.
All right, I appreciate that. I'm going to switch over. Thank you so much for your testimony. I'm switch over to Dr. Maldonado briefly, and I'm changing gears on you just a little bit. But in talking with Mr. Butterfield, you mentioned tuberculosis. I've been looking at phage therapy, and I don't know, because that's a bacterial infection. I don't know, do we have a vaccine, or is there a vaccine in the works for tuberculosis?
Oh, we've been working on vaccines for tuberculosis for 30 plus years. There are some recent updates. There has been a vaccine in the last 5 years that seems to do a reasonable job. That is, it's about 30% effective, but we really haven't advanced as well. Tuberculosis is a very complicated disease. It's a bacterial infection, and we don't really understand very well how it grows. And so we are urging additional resources to understand, first of all, how the bacteria itself causes latent or silent infection, because that's the key. It somehow manages to slow down and then pop up at unexpected times, and that's been very difficult for vaccination. But there are a number of breakthroughs that we hope will be coming through with innovative new technologies at this point. But certainly 1 in 3 people in the world is infected, and clearly a very important target for research. Thank you for bringing that up.
Yeah, absolutely. And as we deal with, and it's something I've been interested in, because I read a marvelous book on, about, I think it was Strafty is the family's name, but on phage therapy, which deals with bacterial infections, not TB particularly, but bacterial infections that are now resistant or immune to our current antibodies, and I think that's something this committee and the O&I committee should look at. I yield back, Madam Chair. Thank you.
The gentleman yields back.